Hey there, future nurses. Welcome to Guided by Night. I'm Dr. Knight, your DNP nurse educator and mentor. Today, guys, we're going to be focusing on wrapping up our SBAR series with a concentration on the R and SBAR recommendations. Have you guys ever felt as if you did not provide enough information while giving a report? Or maybe you did not communicate what really matters about your patient while giving a report at the bedside? If so, today I'm going to show you how to put it all together so that you will be able to provide a clear, concise SBAR every time you give report. It doesn't matter who you're going to be reporting off to. So let's get started. We're going to start by actually clarifying why recommendations matter. You see, recommendations allow you the opportunity to advocate for your patients. When you are advocating for your patients, you get the opportunity now to tell the next provider or recommend to the provider what you think should be happening next in your patient's care. Now, it doesn't mean that they have to follow it, but it shows that you are thinking clearly. You're using your judgment on what you think should happen next in your patient's care. Ultimately, it's your way of keeping your patients safe and moving the care along. So let me start by just reminding you that you are not guessing the doctor's orders. It's actually you communicating your nursing judgment based on your assessment of your patient. When you provide clear recommendation, it helps your team move faster, act faster, and it also prevents you from leaving out important information. Here's what I usually tell my students. Think of SBAR like this. The situation tells what's happening. The background explains why it's happening. Your assessment shows what you found. And the recommendation moves the care forward. If anything, guys, just try to think of it that simple. This will help you stay focused and avoid you from rambling on and on. Now, let's move on to some key information that's going to help you maintain a strong recommendation. Here's what I want you to concentrate on. Be specific. Say what you recommend. Say exactly what you recommend. Don't be afraid, guys. Be action-oriented. Include what should happen next. And the last thing is be respectful and confident by simply saying, I recommend, or would you like me to? Here's a good example of a recommendation. I recommend increasing oxygen to 4 liters and obtaining a chest x-ray. Would you like me to draw a CBC and ABGs as well? That's clear, concise, confident. You're not being bossy, you're being proactive and professional. Let's move on now. I want to give you a full SBAR example. So listen up closely, guys. Let's again imagine you're giving a report on Mr. Johnson, who was admitted yesterday with pneumonia. Here's the SBAR example. Situation. This is Olivia. I'm the student nurse on 4B. I'm calling about Mr. Johnson in room 214. His oxygen saturation just dropped to 85 on 2 liters, and he's short of breath. Here's the background. He was admitted yesterday with pneumonia. He has a history of COPD and hypertension. He's on IV antibiotics and 2 liters nasal cannula. Listen to the assessment. His respiratory rate is 30, lungs have wheezes throughout, and he's anxious and using accessory muscles. He appears to be in respiratory distress. Here's the recommendations. I recommend increasing his oxygen to 4 liters and obtaining a chest x-ray. Would you like me to call respiratory therapy as well? Guys, can you hear the difference? It's focused, it's professional, and it gives the next nurse or provider everything they need to keep your patient safe and to make the best decisions on what to happen next with your patient. Now let's move on to student to nurse handoff. Here's an example of that. Hey, this is Olivia. I'm giving you report on Mr. Johnson in 214. He's a 72-year-old admitted yesterday with pneumonia and COPD. His oxygen saturation has been trending downward from 94% to 85% on 2 liters. He's on IV antibiotics and his steroids are being tapered. Assessment shows increased work of breathing with bilateral wheezes. I've already increased his oxygen to 4 liters per the doctor's orders, and I'm recommending that you closely monitor and follow up on ABGs. That's a complete professional SBAR that communicates clearly and inspires confidence in your teamwork. This is what we want, guys. Here are some takeaways, okay? Please try to remember this. SBAR isn't just about a structure. It's about critically thinking and communicating like a nurse. Recommendation is where you own your voice and you advocate for what your patient needs. Your patients are counting on you. They are relying on you to communicate their needs to another healthcare provider and actually delivering the best care that you can. The last thing is the more you practice SBAR, the easier and more natural it becomes. And I'm telling you guys, there are still nurses practicing every day that are struggling with SBAR, particularly the recommendations part, because somehow nurses feel that the doctor should be telling them what to do. But I'm here to tell you that you have a license and you should be able to critically think and recommend what should be happening next for your patient. So don't be shy here, guys. Start thinking critically and providing your recommendations. Here's a closing remark for you guys. The next time you're in clinicals or you're participating in a simulation, I want you to practice giving a complete SBAR. Start from the beginning to the end. Write it down, speak it out loud, and most importantly, ask for feedback from your instructor or the primary nurse at the bedside. Feedback is going to help you grow, guys, so don't be afraid of receiving constructive feedback. Here's what I want you to remember. Clear, confident communication saves lives, and remember, SBAR is your superpower. I'm Dr. Knight. I want you guys to keep learning, keep leading, and I'll see you guys in the next episode. Do me a favor, guys. Make sure you hit subscribe, hit the like button, share it with anyone that you think may be struggling with SBAR. Happy clinicals.